Joseph Radigan. I am a faculty member at the Brigham and Women's Hospital in Internal Medicine, where I am the Associate Chief of the Division of Global Health Equity. And myself and two of my co-authors, Dr. Paul Drain of the Massachusetts General Hospital and Dr. Heidi Befferuse of Brigham and Women's Hospital, recently published a perspective piece in the New England Journal of Medicine about obtaining a social history. So physicians typically ask patients obtain a social history, which usually is quite limited in daily practice. It usually involves some questions about patients' marital status, their habits, including use of substances like smoking, alcohol, drug abuse. Sometimes we ask a sexual history, but that usually is about it. So there's been a lot of research that shows that a patient's social environment greatly affects both their health and our ability to deliver health care to them. So we essentially advocate for the social history to be more extensive, to be able to ascertain some of these factors that research has shown is important in health outcomes. So some of those factors are things like a patient's social supports. What kind of social environment do they live in? Do they have close friends? Do they have family members who they can count on? What are their beliefs around health? Do they have religious beliefs or organizations that they belong to that allow them to maintain a healthy lifestyle? Or on the opposite end of things, are they in a social network or have a social environment that is detrimental to their health, where people engage in unhealthy habits? Other things we want folks to think about is financial issues. Do patients have secure employment? Are they able to pay for their medications? How do they travel to and from health facilities? Do they have the ability to get to the appointments that they need to get to? And then thinking even larger about where people fit into different social groups within their communities. So we typically at our hospital see patients with complicated social problems as well as complicated medical problems. So we often we're very well trained as physicians and healthcare workers at addressing the healthcare issues. But we sometimes don't think about the social problems and how they impact health. And oftentimes we don't ask about them because we feel like we don't have an ability to deal with them. But we're essentially saying that some of those social factors have huge influence on our ability to deliver health care and health outcomes. So how might this play out, for instance? We typically see patients with chronic medical conditions like diabetes, hypertension, heart disease, lung disease, who require ongoing medical care and often have exacerbations of their illness that wind them up in the hospital. It makes a big difference whether that patient lives in a social situation that allows them to take care of themselves and empowers them to take ownership over their health, versus living in a social environment that doesn't do that. And again, how might that play itself out? We commonly see patients with diabetes who have difficulty affording a healthy diet, don't have access to supermarkets and other facilities in their neighborhood that sell healthy foods. And even if they did, there might be a risk of violence or other problems, barriers to them being able to shop and get the food that they need. And so they wind up, with unhealthy diets of convenience. Similarly, in terms of the medications they might need to take, like insulin. Insulin is fairly inexpensive, but it still requires regular visits to the pharmacy to pick it up, and some kind of ongoing relationship with a primary care doctor to manage the diabetes. If people have difficulty getting to the hospital, that relationship is difficult to maintain. If people have poor communication because they speak a language other than English, or they're just not at a reading level in English that the healthcare facility assumes they are, They'll have difficulty reading the instructions we give them. They'll have difficulty accessing the healthcare system and navigating it. Even though physicians can't directly change people's social situations, we find and we advocate that by understanding them, it gives us much more insight into the patient's life, and allows us to better tailor our therapies and our communications to the real lived circumstances of our patients' lives. And this plays out in multiple different dimensions. Knowing that someone has a difficult living situation will maybe foster the physician to spend a little bit more time explaining things to the patient, to ensuring the follow-up plans are in place and not relying on the patient to make a bunch of follow-up appointments, but rather making them for them. Similarly, just by connecting with the patient and talking about these things, patients feel much more connected to the health system. They feel like there's a physician who understands where they're coming from, and there's a much stronger therapeutic alliance that one can build. So some folks who we talk to about our thoughts often push back and say, this is great, but who's going to pay for this? This is just more time spent talking to patients and not getting down to the kind of the heart of our expertise. And we would say that this is actually one of the most important parts that a primary care physician and a health provider can do, is to address this, is to integrate the patient into a social context and not see them as just kind of a freestanding biological entity, but rather bring them back to their social environment. And when we think about where we're going in U.S. healthcare, with the Affordable Care Act, increasingly doctors are going to be paid for the outcomes of what kind of healthcare they deliver, and not just the amount of healthcare services they deliver. And when we think about increasing the effectiveness of our healthcare delivery and increasing the value that we provide for patients, thinking about the social context is an important one, because it's often the place where our therapeutics and our communications get frustrated by the lived experience of patients in their social environments. So paying a little more attention to that will actually, we advocate, will actually increase our ability to affect patients' lives, ultimately lead to better health in our patients. And again, under the direction that the American healthcare system is moving, those will be the outcomes that are incentivized through increased financial payments to physicians.